Hello, and welcome to CareSmartz360 On Air. I'm Dennis Gill, Senior Sales Consultant at CareSmartz360. Today, I'm excited to welcome Shaun Farrell, Area Sales Director for Greater Los Angeles at TheKey, where he drives partnerships that meaningfully boost referrals and revenue in both non-medical and full concierge nursing services. Tune in as Shaun breaks down how smart collaborations transform pipelines and power sustainable growth for agencies in competitive markets. So, welcome to the podcast, Shaun.
Hey, yeah, thank you, Dennis. Thanks for having me. I appreciate it and excited to be here.
Well, we're really glad that you were able to take time for our audience today, and I hope it is a pretty fruitful and an a session where there is value added to all the audience that is listening from to our session all over the world today.
Yeah, I hope so.
Okay, so without wasting any time, I'll just jump in with my first question for you, Shaun. So, John, what type of referral partners have historically driven the highest conversion and revenue for agencies?
Yeah, I think it kind of depends on your business model from a home care standpoint and kind of what you're
Mhm.
looking at. So there's two different, I guess, two different avenues that you can go on. You have more of your low volume, high revenue
Okay,
referral channels, which can be more of your wealth advisors, your fiduciaries, geriatric care managers.
okay,
These are more like your trusted referral partners from a high revenue standpoint. So they
got
have
it.
more of the higher revenue net worth clients, especially
Hmm.
because we are in a predominantly private pay world on the
Yeah,
home side. So when you're talking about it from that standpoint, if you're looking for more low volume but high revenue, that's probably more of the trusted advisors is kind of what they call it,
hmm,
um, channel to go by. Now, there are other companies out there that go a little bit more high volume, slightly lower revenue,
okay,
where it's kind of like you're casting more of a wider net. And there's nothing wrong with any of these channels because it's also to say it's not like you can't get a high revenue client from this channel either. But some of these are a little bit more just high volume, slightly less revenue to where you're talking more skilled nursing facilities,
okay,
hospitals, to where there's many discharge charges per day or per week or whatever it might be. The unfortunate thing, especially living in a large metropolitan area, is that I say unfortunate from a business standpoint, from a home care private pay standpoint,
yeah.
not to sound, you know what I mean, not to sound
No, I
harsh
get it.
or
I
anything,
completely
but
get
it's
that. No.
speaking completely from a business standpoint, it turns into slightly more of a payer mix that we just can't service because of what we do.
Uh-huh.
Trust me, I think everybody listening would love if, well, I don't know if everybody, but I know I would love if Medicare covered our services.
Yeah,
And there's certain
yes.
Medicare Advantage plans that some companies are partnered with, but the
Uh-huh.
benefit is very slim. So
Very
we're
well.
mainly going after those private pay clients and long-term care insurance where it comes into play. And
Okay.
generally, your wealth advisors, your geriatric care managers, these are the people that have the right clientele that lead to that longevity.
Okay. Good to know that. And how do you recommend agencies cultivate and maintain strong relationships with hospital discharge planners and physicians?
Yeah, I think especially hospital discharge planners, I think the biggest thing is they're busy.
Uh-huh.
They see a whole lot of you and me and everybody a lot, and that's just like one little part of their job. So I
Got it.
think coming in and making it as if you are going to come in to talk to them, if you are going to come into whether it's pitch your own business or whether just, I feel like getting down to what their actual real issue is in their
Hmm.
internal job. Like, what are they struggling with on a day to day? That is really whether it's keeping them up at night to not to be cliche, or it's
Yeah.
this is essentially just what is weighing them down. Um, and sometimes it's readmissions. It's worried about getting
Yep.
folks out of the hospital, but they don't have a sniff that can take them. And how might home care be able to help in certain scenarios where sniff's not really appropriate, but maybe home care is a little bit more appropriate? Having
Yeah.
these types of conversations with them and try not coming in at shift change. I think that's a really big one as well.
That's a big thing. Yeah,
Um,
correct.
trying to pick and choose what time of day you go in. It really does help sometimes
Okay.
too, because there are really stressful times and like
Yep.
pivot points of
I'm
the
changing.
day for them.
Correct,
Um,
correct.
then with physicians as well, really getting in tight with their receptionist, their PAs if they have a physician's assistant. That's
Mm-hmm.
really like their right hand person
Yep.
half the time. And honestly, the PAs are the ones that do half the referrals anyways. The doctors might just refer it over to their PA and be like, "Hey, refer this out or help me. I have to go see six other
Correct.
patients right now." And the PA
Definitely.
is the one back there doing everything themselves,
Everything.
right? So
Yeah.
like trying to get to know the whole team in the physician's office outside of
Mm-hmm.
just strictly targeting the doctor, because half the time the doctor is gonna. I love doctors. I'm not, once again, I
I'm not.
preface this with saying I've been doing
This is
this
in
for
general.
15 years. I've
Uh-huh.
had a lot of different experiences, but the doctors are really, they're really busy. They're probably
Yep.
trying to do notes half the time, and you're coming in there and they're like, "What do you need, Sean? I got 2 seconds for you." And then it's like, the PA and the front desk people are a lot more willing to give you a little
Willing
bit
to.
more time. So I feel
Yeah.
like it's developing that relationship with them too.
And they can provide you much better information than the doctors also because they will have more detailed information about the person, right?
100%. And once again, this takes away nothing from the importance of what the doctor's
No,
doing. It's
no,
more just
definitely. Not at all. Not at all.
yeah, the PA is more on the back end, right? They're the
Yeah.
ones figuring out everything, especially the continuity for when they go home. What might they
Mm-hmm.
need? Setting up DME, setting up a lot of the background noise that the doctor
Mm-hmm.
just doesn't do normally. So
Yeah.
while it's good for the doctors and physicians to know what we do, I think it's much more beneficial from a standpoint of figuring out who actually makes the referrals. It could be the
Correct.
doctor, but it could
Correct.
actually be somebody else, right?
Correct. Correct. And what are common pitfalls agencies face when building partnerships that are meant to generate steady referrals?
I think falling in, this is the term I used. It's kind of more of a modern term, I'm sure, but it's falling into the friend zone, as they
Friends
say,
are.
right?
Mm-hmm.
A lot of sales folks always, I'm sure we're familiar with this if you're listening to this podcast or listening to this broadcast. You tell your boss, man, like I have such a good relationship with XYZ. I'll go in there, I know everybody, we high five, we talk about the weekend, and I just never get anything from them. You have
Yeah.
essentially turned into their donut delivery Uber Eats person that comes and just gives them donuts on
Correct.
Friday,
Correct.
and
Yeah.
you're sitting there shooting the breeze with them. And it seems like, man, like this is such a good referral source for me. But then you look at your ROI on it, and
Mm-hmm.
it's been nothing for the last three
Nothing.
months.
Yep.
So, and you're trying to figure out why, and it's because you're doing a really good job of breaking down the barriers, but it's almost
Mm-hmm.
turned more into it's gone too far into the other direction of friend zone. They almost
Okay.
forget what you do. They
Uh-huh.
forget that you're there for a reason as well. It's like I do want to be friends with some of these folks, and I actually
Yep.
am. Like it's some of my referral sources, we've grown really close over the years.
Mm-hmm.
But the reason why we've stayed close too is because of business as well. Like there's a certain give and take
Okay.
to where I had a referral source say this to me the other day. They're like, Sean, I get it. You're not a volunteer. I
Mm-hmm.
understand. Like so like there when I have these conversations and you kind of have to call certain folks out sometimes to be like, and it's
Yep.
okay to do so, to be like, hey, I've been coming and doing, a program at your place for the last 6 months, once a week. I've been coming to see you. What can
Mm-hmm.
I do to really earn that business? It sometimes being direct, if you're
Correct.
already not getting referrals, what's there to lose? You
Was
know what
there
I
to
mean?
lose?
Like that's kind of
Definitely.
how I view it sometimes. So
No, rightly said. Rightly said. Obviously, you don't have anything to lose at that point of time. And even if you get out something out of it, bingo. There
that's
you
what I'm
are.
saying. Yeah. So, but
No,
yeah, being friend zoned. That's my one thing. Try not to get friend zoned in a relationship at work. So.
correctly. Everybody has that. All right. And just continuing with this, how can agencies measure the ROI and revenue impact of strategic partnerships effectively?
Yeah, I think especially like for me working at TheKey, we're a national company. So
Mhm.
we have a lot. We've been in business for over 25, like between 25 and 30 years. So I mean, we
Okay.
have a lot of integrated systems, software systems that we run internally. I think
Okay.
especially depending on who's listening to this, right? So you could be working for a large corporation like TheKey, or you could be working more in a mom and pop. I think it
Mhm.
is important to have a customer relationship management system, so some type of CRM. and then something like Salesforce or something like that to be able to track your meetings. And I
Correct.
know that this is a certain issue. I was thinking about this question. This is an issue with, I feel like, and it's not a knock on them, but it's an issue sometimes with smaller mom and pops because it's a big
Okay.
investment in the beginning, right?
Yeah.
Salesforce isn't cheap, right? Some of these CRM systems are not necessarily cheap. It's a lot per month. It's hard to
Yeah.
do. Oh, then I could just I'll do a lot of this via paper, and that's what makes me kind of mom and pop. That's what makes me different. I understand that from a certain perspective, right? And like mom
Mhm.
and pops, I think have a really good competitive advantage in certain areas compared to something like TheKey, right? Like
Okay.
there are certain pros and cons that you can argue for both, but I really
Definitely.
do
It
think
is.
that CRMs and things like that, it's something that you really can't skimp on because you have to be able to track your ROI month over month. You have to be able to see, okay, all of this effort I've been putting in at XYZ and all these places for the last like year, what has it
Yeah.
netted me? Right. And
Okay.
Salesforce and things like Salesforce, you can run reports to where it shows your ROI over the last 3 months, 6 months, 9 months,
Yep.
year,
Yep. Yep.
multiple years. And you can build that out and look at trends over year to be like, oh, you know what? I didn't actually realize that this senior living community was giving me a little bit more than I thought, and I haven't really been leaning into that. So I feel like really having some of these CRM systems, having Salesforce, having something like that to really track and measure these things is so important as opposed to just winging it. And I know sometimes there are companies that don't want to just wing it, right? And they're like, oh, I just don't have the capital to do it. It's
Yeah.
hard.
Yep.
I
Correct.
understand that. Like I get it, but I do think it's vital that you have some type of tracking system, or you're just going to get lost. You're going to assume things because I've assumed that I had a really good referral source somewhere. I've gotten a
Hmm.
lot of referrals, but we never converted them. So that's another thing that
Okay.
I'm looking
That's
at.
another thing.
How many
Yeah.
leads? Because that's something that Salesforce does. Your leads to opportunities, your opportunities to conversions.
Conversions.
And if
Yeah.
there is a gap there, we got to figure out, are they actually giving us, they're giving us referrals, but are they actually giving us the referrals that we can open? You know what I
Okay.
mean? So um, that's kind of my biggest thing is that, stay in tune with if you don't have a CRM, I understand, like I said, from a financial standpoint with some of these companies, but you
Mm-hmm.
have to have some type of system that tracks your
That
ROI. So
tracks it.
maybe you're
Yeah.
really good with Excel or something like that. I'm not, but if you really are,
Yeah.
fine. You
Hmm.
can build out your own, but you have to be able to track
Yeah.
and measure.
And yes, they get a proper funnel for that, and that funnel can be tracked in a very right manner. I've seen this. I've seen this many agencies because I've been working with the home care agencies now since 2019 for the past 7 years now. And they know with the mid-sized agencies or the established agencies, I would say, they definitely do require this because they do
Yeah,
require that they need to track all these things. And it is pretty easy for them also then that everything is
good.
there
Yeah.
in front of them. Yeah,
I'm just
correct.
speaking on behalf of from I worked with TheKey. I worked for Maxim Healthcare, which is a very large staffing and home care
Yeah.
company for 6 or 7 years, and I
Okay.
also worked for Accent Care. So it's one of the really big. I've worked for a lot of major
With the
home care
bigger
companies,
corporations. Yeah.
and it's really one of the key threads that has been something that has helped me at all of those companies be able to track my ROI and really track where I'm going right or wrong with certain clients.
Mhm. Correct. Okay, now the thing everybody wants to talk about from your experience, how can AI tools support referral and partnership workflows in home care operations?
For sure. So it's so funny. It's, living in the day and age that we're in. This is what, May 28th of 2026. There's been a lot of AI talk,
Mhm.
especially in commencement speeches recently, to where I've seen colleges booing people that have been talking about AI.
Yeah,
That being said, AI can be used in multiple different ways. There are certain things about AI that I think a lot of people can be wary of, but
hmm,
there's also certain things that AI can do that really basically can enhance what home care companies can do while
hmm,
simultaneously not really replacing anything that we do. It just makes our job more efficient. It allows us to actually, for example, I'll give a perfect example. So there's two ways. One, there's an AI system that we actually utilize that summarizes a lot of our referral history with all of a certain account. So let's just take
got it.
UCLA, for example. It
Hmm.
shows up in Salesforce. There's an AI summary of here is your historical relationship with UCLA since the beginning. I think as a
Okay.
new salesperson, that's learning, let's say you're brand new at TheKey and you're trying to learn your new territory, this is
Mm-hmm.
extremely helpful and time saving to where you
Okay.
can get an AI summary to be like, oh wow, like this helps me immensely. This helps me look at what our relationship is, as opposed to going back in and looking at notes that could take you hours. So AI can really help you get more to the nitty gritty of exactly what we need to do quicker.
Mm-hmm.
So we actually get to do what we're paid to do, like our real job faster. I think
Yep.
the way AI can be utilized as well, the other way that I think companies are, I know there's startup companies that are trying to do this, and we're actually implementing it too. When we
Mm-hmm.
go out, there's certain systems and companies that have programs to where when you go do an assessment, for example, I go to a
Mm-hmm.
client's home, there's an AI software we can set up, and we obviously get the permission of the client before we
Right.
do
Yep.
it. But we said, hey, do you mind if we record this session?
Mm-hmm.
Because instead of us writing down by hand or even typing down the assessment, we can just have a full conversation. You and I, just like you and I are having,
Mm-hmm.
and the client can tell us their likes, dislikes, where they grew up, everything, their
Uh-huh.
ailments, what their medication list is, anything that we might
Wonderful.
need. And
Uh-huh.
AI will take that, put it all into one, and make a care plan out of it. And it's all HIPAA compliant. There are
Mm-hmm.
companies, there are little startups that are doing this. We actually are implementing this
Okay.
currently. So we have something like this. And once again, this will never replace our internal client
Internal.
success managers, or like it's like our internal case managers. That's like what we call
Yep.
them. They oversee our clients' care, all of
Mm-hmm.
those things. It's never going to replace them.
Obviously.
Simply, all it does is cut out the 2 to 3 hours of paperwork they would have when they go back to the office writing this care plan, right? Now they have an AI summary, essentially a full comprehensive care plan of the
Mm-hmm.
conversation they just had with that family. And then they can add in other things that either it missed or that they wanted to add on the back end. And then they can read through it and essentially double check that everything looks correct. And it's all HIPAA compliant. The family signed off on it. It's not required. Like obviously, we give this to families if they want to participate in it, they can. They don't
Yep.
have to. But these are just certain ways to where AI, like scary AI, can actually be beneficial
Uh-huh.
in certain ways. Because I know, once again, it's a hot topic right now, and I
Yep.
know a lot of people listening to this probably have it, people in their LinkedIn DMs saying, "I have this AI software. I have this AI software."
Obviously, yeah.
It's everywhere right now.
Everywhere.
So
Everywhere.
it,
Everywhere.
it's a lot of noise, but I do think there are certain aspects of it that can be highly utilized because my biggest thing is companies and the employees of the companies, when CEOs and all these people start talking about AI, automatically creates fear internally. It
Yep.
automatically creates like, oh, great, AI, now I'm going to be replaced. Like
I'm
that,
gonna
that's
replace.
just,
Yeah.
it's automatically what pops into people's minds, right? And I don't blame them, right? At the same time, I think when you implement certain AI tools like this, they can just simply enhance them and allow them to do their job better, not
Mm-hmm.
the threat of replacing them. That is where I feel like it could help utilize or more properly utilize internal employees. It can help
Mm-hmm.
our relationships with referral partners because we can do assessments quicker.
Mm-hmm.
So if they're like talking about a fast start, bang, we can do this conversation. The care plan's already been written in a matter of minutes, and we can
Yep.
start that shift right away, as opposed to, well, I got to go home and write the care plan real quick. We can start in 3 to 4 hours. Now the care plan's written in 3 to 4 minutes. You know what I mean? So
Correct.
that's something, once again, just like two examples of ways that I know that we currently utilize it that I'm sure either other companies are thinking about or also currently doing.
Correct. So, guys, you can just have a look at this. That don't be scared of AI. Obviously, there are some places where AI has some more work, but in home care industry, I see the human touch is always required.
Always. I think in healthcare, we all kind of know there are machines that can do surgeries nowadays, right? The really
Yeah,
intricate
I
surgeries,
do.
but
Yeah,
are still vastly needed, as we all know.
definitely.
And nurses, I don't think, unless we're eventually going to go into the iRobot phase of life, where nurses are just replaced by these Boston Dynamic robots, I just don't
Robots.
see it happening in the next couple 100 years. I mean, it's just there is
I
still that
can't do that. Yeah.
until AI gets fully forward thinking as opposed to reactionary. Because a lot of
Mm-hmm.
what AI is doing, it's taking information, right, that it already has access to, and
Yeah.
then basing everything off of that. A
Absolutely.
lot of nursing decisions and whatnot, some of these and physicians and things like that. It just it's more forethought that goes into a lot of it, and there's
Hmm.
more imagination that goes into certain things. There's more hypothesizing, and AI I don't think is to that level yet. I don't know if it'll ever get to that level, and I'm also not the biggest AI expert as well. But I still think there's that human element to a lot of this that
Human element is
AI
required.
can't touch, if that makes
Yeah.
sense.
A small thing would always be there where a human touch is required.
100%.
Okay, and lastly, Sean, looking ahead to 2026, what emerging market trends should agencies consider when planning long-term partnerships to scale revenue?
I think for home care right now, I think in general, I think everybody's kind of feeling it. And I think if we can all put on our honesty hats, I feel
Mhm.
like 2026 has been, and it's not just in home care. I think it's in senior living because I have a lot of really strong senior living partnerships. And
Okay.
they'll come to me, they'll be like, Sean, man, it's been slow this month. What's going on? How are you guys doing? And I think it's just with talking about the market, the economy's been interesting recently, right? Gas prices have gone up, which have
Yeah.
caused shorter shifts for us to be harder to staff
Hmm.
because caregivers don't want to take shorter shifts because gas prices are higher.
Got it.
And
Got it.
it's a trickle down effect everywhere because now we have to then tell families, well, hey, if you want more consistency, we have to get longer hours. But if everything costs
Oh,
more, they don't want to do longer
they
hours
don't
because
want
they
to pay
can't
more.
afford it. So it's
Definitely.
this circular thing that we're kind of going through right now. I think that being said, you and I can't do much today to really have any change on that. So how do we combat this? It's really leaning into some of these trusted advisors because we're
Hmm.
going through the boomer age, right? The silver tsunami, as they're calling it.
Okay.
There's I can't remember the number, but there's thousands and thousands of people turning 65 every day. Like I saw the number and it was alarming how many 65 year people were turning 65 every day. And
Okay.
eventually these folks are going to need care. The good
Definitely.
thing is for them, I feel like this generation is more into in the 2026 era that we're in right now is that the boomer generation is actually taking care of themselves a little bit better than their predecessors.
Yep.
Feel like weightlifting and them, yoga. Like I feel like the health trend that has been going on for the last 10 to 15 years has helped and it will help their longevity. But I think really, and once again, I didn't want to get sidetracked, but I think as a home care company, leaning into more of the wealth advisor channel,
Hmm.
leaning into more of the trusted advisor channel, I think is going to be crucial because once again, as inflation rises, things just get inherently more expensive. It's going to be harder as we keep going on for folks to afford our type of services. Um, from a private pay perspective. And I mean folks as in everyday folk, right? Like
Got it.
to be completely honest with you, like most, I the amount of if I my mom fell and had something, knocked on wood, obviously, but if she
Hmm.
if one of my family members fell and needed 24/7 care, it's a lot of money. And I think to kind of wrap up my point, I think more companies hopefully will start leaning into preventative care for a
Yep.
lot of these folks because I feel like where a lot of home care companies get a bad reputation is people will push off caregiving, they'll push off a companion for mom or dad or grandpa or grandma for a while, and they're like, oh no, they don't need it. And then the fall happens, right? And I
Yeah.
hate to say this, but it does. And it
It does.
unfortunately it kind of will. And I really need people to understand that it's not a if, it's generally a when. Um, and when it happens, hopefully it's okay. But if there is a broken hip, if there is something that is drastic, that's when it goes from being a manageable amount of money to a ridiculous amount of money.
Ridiculous.
Because if
Yeah.
it's 24/7, we know how much these numbers can get to,
Definitely.
tens of thousands of dollars. And then people, especially on a concierge nursing side of things, if you need any type of IV help, any type of medical help when you go home, it's like you can double what caregiving is from a financial
Hmm.
standpoint. So I think it's really like trying to use this as preventative care. Like, hey, let's get somebody in there for 3 days a week. Get dad a companion, get mom a companion, and start leaning into more of the wealth advisor channel. So I guess it's twofold. It's trying to be as preventative as we can be. So A,
Hmm.
we're in the house already. So if there is a fall 2, 3, 4 years down the line, they already know who we are, right? They're familiar. They don't have to
Yes.
Google. They don't have to, oh no,
They don't
who
have
do
to
I
find
call
a, yeah.
now?
They don't
They
have to
have
find a version for that. Yeah.
Right, but and then B, it's really lean into the wealth advisors because there are folks that are going to be starting to prepare for this because they
Mm,
know that inflation's high. They know, so they're going to start preparing when they're, I don't know, my age, your age, and they're going to start throwing money into certain areas to where they know they can pull out of it later and utilize it.
yeah,
So really, really utilizing wealth advisors and just educating them on what we do, why we're important and not to forget about us because it's very important. It's one of the largest expenses that seniors can have later in life
definitely,
is
definitely.
unexpected medical expenses. It can absolutely wipe out an entire savings of seniors. And I sometimes I feel like I don't mean this to all wealth advisors, but sometimes I feel like they know it, but
Hmm.
it's kind of one of those like in the background things where they're like, yeah, but let me work on his investments and he
Other
wants to go
things,
to he
just
wants to
working
go to
on other
Europe
things.
next year, you know?
Yeah,
And it's like, I get that. I understand that. And that's great. And get them to Europe, no problem. But also make sure that we have the proper channels set up to where if slash when that fall does happen, we are considered and we're remembered.
consider.
You know what I mean? So,
Correct, correct. No, thank you, Sean. Thank you for your time today. It was a great, wonderful session, I would say. A lot of inputs. I hope our listeners would have loved that. And it was a very, very fruitful session, I would say, specifically for me and the other agency owners or nurses, whoever is listening to this. So we really thank you for your time today.
yeah, thank you for having me. I really appreciate it. And feel free if anybody wants to reach out to me on LinkedIn. I'm always, my DMs are open. Feel free if anybody wants to chat.
All right, so everybody has that. So thank you again, Sean, and thank you, my listeners. I will be back shortly with you. So this is Dennis Gill signing off, and I will be in touch with you shortly again.